Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, it's more COVID-19 cases in Nigeria, with Lagos worst hit. Beating the coronavirus, former Ogun State Sports Commissioner tells his story. And the Africa Center for Disease Control says the continent needs 15 million test kits in 6 months. Getting more worrisome as the figures from the Nigeria Center for Disease Control (NCDC) puts the total confirmed cases in Nigeria at 442, with most of the cases announced coming from Lagos. A breakdown of the cases in each of the states show Lagos now has 251 cases, Abuja, the FCT, has 67, Kano has 21 cases, Osun with 20, Edo State has 15 cases, Oyo 13 cases, 9 in Ogun State, Katsina has 7, Bauchi, Kaduna and Akwa Ibom have 6 cases each, Kwara, Delta now have 4 cases, Ondo has 3 cases, while Enugu, Ekiti, Rivers and Niger each have 2 cases, with Benue and Anambra recording 1 case each. A total of 152 patients have been discharged, while 13 deaths have been recorded. Now, the Nigeria Medical Association NMA Edo State branch wants an increase in the test for COVID-19, as they're saying it would help people better understand the reasons and, that they've been asked to stay home or maintain a physical distance while in public. The Edo NMA chairman, Mr. Valentine Omoifo, also disclosed that the association has opened helplines for people with health-related questions to call and get answers from doctors, as well as over-the-phone prescription where necessary. The numbers are 0811-264 555 or 0811-276 555, as you can see on your screen.
Now, we may have so many asymptomatic cases with no symptoms, and they're moving around. If you tell them, they don't understand why they need to stay at home and stay away from people. So if we have a policy of testing, many people create more test centers. In some countries, you have drive-through test stations. Anybody could just stop by, your sample is collected. It's going to make it easier for us to identify those who have all these viruses, whether or not they have symptoms, and they will take necessary action. Now, if we can do that, we would have gone a long way. Apart from that, we need to do more sensitization of the people. Here we need to further engage stakeholders, religious leaders, traditional rulers, market people, meet with them regularly, their leaders. If we have to meet throughout Zoom or whatever, or we're spaced out sitting arrangement, but we must do these meetings regularly and carry them along. Let them know on a regular basis where they are failing. I don't advocate for total lockdown like in our state because of the economic impact, But like I've told many people here in Edo State, the partial lockdown should be properly enforced. The NMA is doing a lot of enlightenment, we talk about the billboards, the banners, and we encourage people to stay at home. And that's why we've created some hotlines here in Edo State. And other states have similar hotlines for members of the public to call and talk to a doctor.
Now, one of those who was recently discharged from the Aba Infectious Disease Center, Lagos, is Mr. Bukola Olopade, former Commissioner for Sports, Ogun State. He's talking to us exclusively since he got out. Mr. Olopade, thank you for joining us and congratulations on beating COVID-19. Tell us, when were you diagnosed for the virus?
Good afternoon. Good afternoon, viewers. Thank you for having me, and thank you for the congratulatory message.
Tell us, when were you diagnosed for the virus? Did you visit high-risk areas, or was the case that of a contact being traced?
No. So what happened was that 12 days after I got back to the country, I did fall sick. I came down with a very strange cough and a blinding headache. So I did self-treat myself at home and isolated myself immediately. And after 4 days of treatment, the cough and the headache disappeared just as it came, abruptly. But I got an advice from my doctor to still go ahead and get tested. So I called the NCDC and the Lagos State monitoring team, who came to test me. And 3 days later, the news that everybody most dreaded came, that I was positive. And I got ready and I left for Yaba, where a fantastic team took care of me. And after 3 weeks, here I am.
So tell us what went through your mind while you were waiting for the test results, and then when you eventually got it, what was going through your mind?
I wasn't really disturbed during the transition of waiting for the results, because I'd already told those close to me, my wife, my family, my friends, that I haven't studied the DNA of the virus. That I was very worried, knowing the sort of body system I have. I've been asthmatic since when I was a child, and I easily catch a cold or flu from other people, easily. I mean, that's been my history. I've not been sick for 20 years, but when it comes to cold, catarrh, flu, those are my albatross. Once you have it, I shake hands with you. Even when I wash my hands, I start feeling the symptoms. So when I saw the DNA of the virus, I was very concerned. The second reason being that I literally live on the plane. I'm always traveling for business, and I'm always traveling to see my grown-up children in England. And I was worried. So after 12 days, when I came down with a cough, I sort of suspected that I had contracted the virus. So waiting for the results did not panic me in any way. And when the result eventually came back positive, I must confess I felt sick from my tummy, because despite the fact that I said I wasn't too worried, getting the result from Dr. Fetuga over the phone made me very sick from my tummy. And after that, I just got ready, packed my stuff, and just got ready to leave the house to go to Yaba for further treatment.
You know, from what you've said, one could say that you were armed with information, and so perhaps initially you were not scared until you found got the dreaded news. But tell us about those around you, family members, friends. How did they react?
Oh, well, my family immediately were very supportive. My friends were very supportive. Let me tell you one of the life-changing experiences I've garnered from this. It is the importance of family and people around you. The messages I got, the prayers I got were overwhelming. They were amazing, and that only helped in giving me some psychological stability, because by the time I got to Yaba, it was a rude shock that I was going to be staying in a tent with multiple people. I was going to be sharing toilets and bathrooms, things that I've never been used to. However, like a Boy Scout, I was quick to adapt, make new friends, friends that have become my brothers and sisters now, from the medical staff to the patients to the domestic workers. I've made some tremendous friendship from that isolation center. So I was quick to adapt and just decide that, look, I submit myself to you guys. Do whatever you need to do. Get me well, get me free of this virus, because it would be nice to go back to society and just be part of the community again. So yeah, the reaction from family was exemplary. My elder brother was a motivating factor. My wife was amazing. A lot of friends. My dietitian kept on sending me what I describe as the best juice in the world. And that was the juice that some people saw on social media that I was giving out. And I gave those juice out until my last day of leaving the place. So the support system was very solid from home, from friends. I mean, your colleague, Babajide Ogunsanwo, was literally bringing me food from home every day because he had his media pass. And that just relaxed me and got me psychologically ready for the medical team to do their job on me. And what a marvelous job they've done. Fantastic people. Like I said in my video, I cannot joke with health workers, never again in my life, from doctors to nurses to the domestic staff who were literally cleaning my room every 2 hours, cleaning my room, mopping it, and just ensuring that we're given the comfort that we deserved.
All right, we appreciate your time, Mr. Bukola Olopade. Thank you for talking to us. We really appreciate you, and we hope that you continue to stay safe. Still looking forward to the juice you talked about. I haven't gotten mine, but then thank you for joining us.
Thank you. Before you go, let me especially thank my community in Magodo, Brooks Estate. Since I came back, I've not sensed anything like stigmatization. Everybody have been amazing. I was jogging this morning. Everybody wanted to greet me, and I kept on saying, social distance, stay away from me, because now I am the one that is being careful from people who have not had it, now that I'm clean. And the joke was on them, but just to say thank you to everybody in my neighborhood.
All right. Many thanks. The former Sports Commissioner for Ogun State joining us there after beating COVID-19. Let's go over to the Federal Capital Territory. We are still keeping consistent efforts with cushioning the effects of COVID-19, the lockdown on the poor and the vulnerable. The federal government has flagged off distribution of palliative to 600,000 households in the Federal Capital Territory. The Minister of State for the FCT at the ceremony explains that the distribution will capture all the poor and vulnerable in the federal capital. The poor and the most vulnerable appear to be the worst hit in the lockdown measures in place by the federal government. We take you to Ikorodu in Lagos State, where residents who live below the poverty line of $1.90 a day are complaining of the level of hardship they currently face with the lockdown extended. We'll bring you that story when we return. Welcome back. We bring you the life of some living below the international poverty line as the lockdown continues in Lagos. Our correspondent Gimba Umar reports.
Filth litters the streets in this area of Ikorodu. People here not complying with the physical distancing guideline. They look on helplessly and don't appear to trust anybody at this time. A father of four sits outside as he tunes the radio for news on COVID-19 and the arrival of government representatives for food during the extended lockdown with no luck. Houses like this are common, meant for the poor. Here, the facilities are meager, a common corridor with electricity for the single rooms that face each other. The 63-year-old guides me inside where he lives. A television set, a couple of batteries are the most prized of what he owns. His daughter lies on the mattress studying. Life for him under the lockdown, he says, has turned for the worse.
But you told me that you are earning 500 naira per day. Has that changed?
For that 2,000, if you resort 500 and you go again, whether you go stay again or you come and reduce to 500, so as you go make it to go and buy another one. Because the other one is for feeding.
Unusual uncertainty looms for both the young and the elderly in a state that could be best described as depressing. 2 streets ahead, an uneducated single mother of 2 lives with her aged mother. She was seen washing green spinach for lunch as the resources depletes. She also ushers us inside her room. Chairs, television set were her lot as one of her kids, a 2-year-old, sleeps on the floor. She, however, prefers to speak outside. She hopes help will come, and fast.
Do you consider yourself as being part of the vulnerable, the poor of the poor, since you earn just 1,000 naira per day?
I will not tell you that I'm rich. You cannot compare me with the people that they are having more than maybe 50,000, 100,000 a day. Government know the way they can do it that can reach us. They should just go maybe house to house, or they should give counsel. I don't think that that's the best for now. Maybe they just go to house. Ask how many people is staying in this house. They will tell you, we are so in number. Then you drop what you have.
Households like these are perhaps considered most vulnerable and a target for government's palliatives. It appears, though, that this pandemic has only compounded the problems faced by this group of people, and they can't wait for this to be over so that they can have their lives back. There are several families in there, as there are in other places in this area. Their major challenge is how to feed, how to take care of their loved ones. That's a major challenge which they will face for the next couple of days at least. Gimba Umar for Channels Television News.
Joining us right now is Dr. Esen Ukorabi, GP, A&E frontline staff with the NHS in England. We'd like to thank you for joining us at this time. Tell us, we understand in the UK it's an extension, a 3-week lockdown we hear in Nigeria, just a few states, and an extension for 14 days. And it's really affecting different people differently. But how does the extension in the UK affect you?
Thank you very much. It's true that the UK have yesterday just announced a further extension of the lockdown period to an additional 3 weeks. And the good news is that over the last 3 weeks, we've seen the effect of the lockdown in terms of the number of new admissions in hospitals as regarding the COVID-19 pandemic. We've also seen the curve being flattened out in terms of the number of deaths that we have in the UK. So at the moment, yesterday we recorded about 861 deaths in the United Kingdom. And we see that this number in the last couple of days have been reducing rather steadily. And it shows that the lockdown is working. And so the government has decided to extend for another 3 weeks.
You're also a frontline worker in the fight against the spread of the pandemic. What's the experience been like?
I must say it has been very challenging. These are challenging times, and no one expected the pandemic. And as a frontline worker, I have had to look after patients that have tested positive for COVID-19. And initially, it was a shock. We were all worried. We were all scared. There was shortage of PPE at the start. And, you know, as healthcare workers, you're concerned about your patients. You're also concerned about your health because you don't want to contract this virus while looking after patients. But as time went on, those fears, those anxieties were allayed by the provision of personal protective equipment by the government, and also more importantly, the testing of healthcare workers. A few days ago, a few weeks ago, I had symptoms after looking after a patient that tested positive for COVID-19, or many patients that have tested positive. And in 2 days, I was tested, and my result came back as clear. So that also goes a long way to allay the anxiety of healthcare workers when they have access to testing facilities as well. But I would say generally it's been challenging, but that's the work we do, and we've been doing that.
Perhaps finally, I understand that you completed a course on the virus, the London School of Hygiene and Tropical Medicine, and also you're one of the rapid support team. What do we not know about the SARS-CoV-2 strain virus? I mean, we know it's shaped like a spiky ball. It's a deadly virus spread through droplets, and also perhaps that... So what exactly do we not know about this virus?
I mean, the COVID-19 is a novel virus, so there are lots of speculations around this virus. We know quite a couple of things, but I think one of the most important things that we don't know, which everyone wants to know, is what vaccine can we can be made available for this virus? What's the treatment for this virus? So we don't know that yet. And there are lots of trials going on here in the UK and in other parts of the world as to what best means of vaccine can we come up for this virus. So we know it's spread through respiratory droplets. We know it can be transferred from one person to another. We know that elderly people are more susceptible. Here in the UK, 90% of the deaths have been amongst the elderly people and people with underlying health conditions. But what we don't know is, one, how is this going to be treated? What we don't know is, in the next winter, or will this virus come back again? Will we have a second surge in, this pandemic? So there are lots of unanswered questions as regarding the COVID-19. And we hope that as we continue to study, we continue to research, we can come up with some of these answers to help, the United Kingdom, to help the world at large, basically.
All right, we appreciate your time, Dr. Estienne Ukura, BGPNA, A&E frontline staff with the NHS. Thank you for joining us at this time.
Thank you so much.
Its determination and more measures in place. States across Nigeria preventing the spread of the pandemic amid increasing number of confirmed cases of the virus. Well, let's begin with the Nasarawa State Governor, Abdullahi Sule, who has extended the lockdown of Cairo local government area to the period of 10 days. The governor made the proclamation after the expiration of the previous 2 weeks. He also relaxed a 24-hour curfew previously imposed in the area to enable residents get basic supplies. In Ogun State, the police command arraigned over 100 suspects before the state magistrate court in Abeokuta for allegedly committing murder, robberies, disturbing the peace of the people during the lockdown currently in place in the state. The suspects were arraigned at the magistrate courts 1, 3, 4, and 7 and 8 respectively. Over to Akwa Ibom State, where the government announced an extension of the lockdown in the state by a week from Friday today, April the 17th. Secretary to the state government and chairman of the COVID-19 committee, Emmanuel Ukewem, in a statement, however, said a 7 hours relaxation from 6 a.m. to 1 p.m. today and Saturday will be observed to afford people opportunity to restock their supplies. And in Anambra State, the House of Assembly, they passed an executive bill aimed at preventing the spread of the virus and other dangerous infectious diseases in the state. It's called the COVID-19 and Other Dangerous Infectious Diseases Prevention and Eradication Law 2020. Some of the contents include strict observation of all preventive measures, including hygiene and social distancing. And the Nigeria Center for Disease Control, NCDC, says to remember, face masks are to be worn in combination with social distancing, hand washing, cleaning of surfaces regularly with disinfectants. The website has all the information and statistics of cases across states. You can also access emergency contacts. Over at the World Health Organization, the live feeds are there, the body's strategies and plans on the pandemic. Each moment, it updates on the number of cases and the recovery efforts across board. That's our program at this time. Join us again at 6 p.m. Another update comes your way. I'm Minister Walker. Thank you for watching.